Good afternoon. I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then take actions to try and make a better system for all of us. Down below in the YouTube description box, you'll find a link to the Healthcare Advocacy newsletter, which is the text for today's video. You can also go there and subscribe for free. And it has all of the links and the references that I mention in the talk. They'll be in that newsletter. So I want to talk first about the U.S. government and influenza. The Center for Disease Control said recently, last week, that the seasonal influenza activity is increasing across the entire country. The new subclade K variant appears to be fueling the rise. Meanwhile, CMS, Center for Medicare and Medicaid Services Administrator, Mehmet Oz, has called the seasonal flu vaccine controversial of late and has advised various Make America Healthy Again initiatives as ways to overcome the virus. The CDC estimates that there have been at least 7.5 million flu illnesses, 81,000 hospitalizations, and 3,100 deaths so far in the United States this year. Now, nearly 130 million doses of the flu vaccine have been distributed so far this season. However, that compares to over 143 million at this same time last year. Only 42% of Americans get vaccinated so far this year. It seems that the government's technique of making people worry about vaccination is having an effect. They claim that the current vaccine is not a perfect match for the current mutation of the flu, which gives people pause, and it shouldn't, because real medical experts still believe that the flu vaccine will help reduce the risk of severe illness, including hospitalization and death. Doctors are urging everyone who's eligible for a flu shot to make sure to get one, and they emphasize it's not too late. I recall the words of my late Aunt Sissy in situations like this. When someone said something stupid, like Mehmet Oz, like don't get vaccinated, or it's not perfect, she would just remind us, consider the source. So consider the source, it's Mehmet Oz, trust your doctor instead. It's not too late, get vaccinated. I want to talk now about drug companies because they have an active plan, and here's what it is. Screw the public. Trump has been touting what a great deal he made with drug makers to lower prices. It's not a lie, but what he's touting is actually useless. Drug makers said they plan to cut prices on 9 drugs in 2026. Now that sounds like good news, right? The flip side of those 9 drugs is that they are actually raising the price on 350 others beginning January 1st. That's according to Reuters. U.S. patients currently pay by far the most for prescription drug medicines, often nearly 3 times what's paid in other developed nations. The increases on those 350 medicines come even as Trump has struck deals with 14 drug makers on prices of some of the medicines for the government's Medicaid program for low-income Americans and for cash payers. These deals are being announced as transformative when in fact they just nibble around the margins in terms of what is really driving high prices for prescription drugs in the U.S. That's according to Dr. Benjamin Rome, a health policy researcher at Brigham and Women's Hospital in Boston. The reason we pay more than all other industrialized nations is that they have a healthcare program that covers everyone, and so they can negotiate drug prices for the entire country. We choose to let the drug makers get away with, as they say, caveat emptor, whatever the traffic will bear. The way to bring drug prices in line with other developed nations is to do exactly what they do. Negotiate prices for the whole country, and the way to do that is to have an insurance policy for the whole country. Let's talk about the path to health insurance for everyone. There's been a lot of discussion in the media lately and in Congress about healthcare. Mostly that so many millions of us are going to see Affordable Care Act premiums rise because Republicans refuse to continue the tax credits for those plans for low-income Americans. It highlights just how broken the healthcare payment system is in our country. All the discussion, however, makes me hopeful, and I'll tell you why. Here's a story from Switzerland. In 1985, liberal politicians in Switzerland were pushing hard for universal health insurance to make sure everybody could go to the doctor. Conservatives, then in power, opposed it vigorously until they saw that it was incredibly popular and that they were going to be voted out of office unless they adopted it. They did just that. They adopted it. To keep their jobs, they designed a universal health care system to make sure everybody had insurance and could go to the doctor without going broke. This may be just that moment for the United States, but we need to keep pressure on our politicians so they know it's important, that they could lose their jobs unless they provide universal health insurance. So let's take an action. Let's remind our congresspersons and senators and the president that the way to make healthcare affordable is to make sure that we have a public insurance trust paying private providers for all of us. I'll put a link in the newsletter, and there should be a link below for how to call them if you want, or my favorite way, send a text message. The text is SIGN, S-I-G-N, space, capital P-G, I have to look close, PGGPCX, SIGN PGGPCX to 50409. That's ResistBot. The first time you do it, it will probably check for your name and address, phone number, and email to make sure it gets the letter, the email, to the right representatives. But let me read it to you. We all deserve a healthcare system that works for all of us. I know there's been discussions about tax credits and ACA insurance plans and how many millions of us will not be able to afford health insurance. I know Medicaid cuts enacted last year will force more millions out of their health insurance. I also just learned that prescription drug makers agreed to lower prices on a handful of drugs last week, but are raising the prices on 350 others, according to Reuters. They don't do that in countries where there's universal health care. Our system of paying for health care is broken. 8% of Americans can't afford to be insured, and millions more have catastrophic insurance policies with such high deductibles as to be useless. We pay twice what our 35 peer industrial nations pay with universal health care, and our drug costs can be as much as 3 times more. Our avoidable death rate, maternal mortality, and infant mortality far exceed what our peer industrialized nations have for those statistics. Those are needless deaths because people don't have health care. I want you to make America healthy, and a way to do it is to make sure that everyone can go to the doctor and the medicines they need and get the medicines they need without going broke. Look, 62% of Americans want their government to make sure that all Americans have health insurance that works. That's according to a recent Gallup poll. We can do it. H.R. 3069 is the vastly improved Medicare for All of Us Act. It would provide a public insurance trust paying private providers for all Americans at far less than we pay now. It's about $750 billion a year less in 2025 dollars. This is according to the 2020 Congressional Budget Report, adjusted for inflation. The CBO report is publication 56811. This is for your reference. I recommend you and your staff read the text of H.R. 3069 because it details specifically how we will insure everyone and provide wider coverage at lower cost. I want you to start thinking about what all Americans want and need. We need a healthcare system that works for all of us, and we need to be able to go to the doctor and buy medicines and not go broke. Enact H.R. 3069 now. That's the message you'll send. Down below, send me a comment, send me a link, send me a comment in the YouTube description box. You can also contact me at healthcareadvocacy1@gmail.com. I look forward to hearing from you. Have a good evening.